Any movement on this ankle bother you?
No.
No? Okay.
It's just the hardware. If I apply pressure to the lateral,
Yeah.
I definitely can feel it.
You have metal in there, screws?
Yes.
Yeah.
A plate and 10 screws. Well, a pretty nice fracture.
You don't get nervous being on camera?
No. As
Some
long
people
as I
do.
don't have to talk directly to the camera, I'm good.
As long as you don't have to address the audience.
That's right. And even then, I can make do, but it does bring some small anxiety or nervousness.
How did you find out about the Thai massage jam? That was the first time we met, right?
It was. I don't know if it was maybe in one of the massage groups I originally heard about the jam or had come in contact with you at some point, and from there I've been following forever.
Yeah. Yeah, therapists are funny. In massage entrepreneurs, there's almost 14,000 people, and I'm the admin. And people still ask repeatedly like the same questions. And it just boils down to they don't want to do the work. It's like, well, this is difficult. It's like, yeah. I've never met a business owner who didn't need a nap.
Right. It requires a lot more
And
time and talent to run your own business than it does to work for someone else. That's for sure.
because running the business is its own art.
Right.
It's not just a body work.
Right.
And when therapists start asking me, because I post a lot about photo, video production, social media. So like when I do this to you today, like I don't get paid to give you the session.
Right.
It's like you just get a free session and I get a bunch of video footage.
Right.
And then students will ask me, they're like, what kind of camera should I use? And I'm like, your phone. And they're like, oh, you know, because what you did is you just removed the barrier.
Right.
But they're like, oh, that's real. I don't know.
Yeah, you use
And I'm like, hey,
it.
listen, I've got a camera and a lav mic. You want to come to my place and shoot video for 3 hours?
And then the next excuse is?
Exactly. because I keep removing the thing and it's like, oh, you guys just don't want to work. Okay, cool, that's fine. It's like, you know, if you have a real dream, like I tell people this because it feels like business-wise I'm getting to the point of almost being like a consultant. If a business owner comes to me and says, Robert, I have $100,000 to invest in my business idea. I'm like, boring. But a broke massage therapist with nothing that comes from poverty says, hey, Robert, I got an idea. And I'm like, let's go. The second one is exciting to me.
Right.
And I can't even explain why, because I think having $100,000 to build a business gives you so much cushion and so many advertising options that it's not a challenge.
Right.
How's this on the inside along your calf here?
It's good. Just slightly tender.
Yeah. This feels a little tight down here. But with all the stuff you've had in here, it's not surprising.
Exactly.
Even this on me is pretty tight because I use my legs a lot. There we go. I've a big heart for massage therapists and their struggles, but they're their own worst enemies.
Right.
It's not an outside force. It's like therapists will say, like they'll complain about spa owners. You know, they take such a huge percentage. And I'm like, why don't you and a bunch of massage therapists get together, rent a facility, and just share the space?
Yeah.
Start a co-op.
I think in this industry, the benefit is you make your own rules for the most part.
Yeah.
I mean, there are some state laws we have to follow, yes, but when it comes to business, entrepreneurship, you make your rules.
Yeah.
You don't like the way Spa A does it, then use those the things you don't like to build from it.
It's kind of like you have 4 kids.
5.
5? Have you, have you ever had that conversation? It's like, my house, my rules. You don't like it, move out.
Yeah. Yeah, definitely.
That's basically the same concept with entrepreneurship. You don't like it? Good. You think you can do it better?
Yeah, do your own thing. And this is so true.
Yeah. When I press closer to the knee, is this too much on your hip?
No.
Okay.
Nope, I can feel the pull, but it's not.
Yeah.
It's not too much.
There we go.
Actually, a nice stretch there.
What part of nursing do you work in? Like what area?
Right now I'm doing investigations.
But you said you wanted to work in home health?
I've done home health, I've done corrections, I've done
Yeah.
pulmonology, I've done
Yeah.
addiction medicine,
Ooh, addiction medicine's got to be rough.
I've done psych.
Yeah.
Most of my years are psych and addiction.
You mean there's an addiction problem in America?
Absolutely. Have you ever heard of the opioid epidemic? That's like big news right now.
I never heard of the Sackler family. I talk about it a lot because my bread and butter is like pain relief. Mm-hmm. So massage therapists just don't they don't talk about it much, which I find interesting. So we talk about how good massage is for pain. Mm-hmm. How is this on the outside over here?
It's okay.
Okay. And then up through tibialis anterior, it's okay?
That's all fine.
All right.
I think on the inside it gets a little sore and maybe more towards the ankle.
When I roll you in, no problem on your knee?
No problem.
Okay.
It's good.
Towards the knee or down towards the ankle?
Towards the ankle.
Okay. And then what do you think? A little more medial or just a little more lateral? Since I just went opposite. In other words, out here?
Yeah.
Yeah. Because I moved the opposite way than what I said.
Mm-hmm.
I moved left and said right. There we go. Yeah, or dealing with chronic pain, like having people try to understand that. It's interesting to me because they think of it as like the pain is physical or it's mental. Mm-hmm. And I'm like, you think there's a difference?
Pain is pain, right?
Well, but that's how I see it. And maybe you look at it differently as a nurse with better training, but it's like if you took a pain scale. I do this for people with, because they have pain, right? Mm-hmm. And I'm like, 10's hospital, 0's no pain. I can literally sit down with a person who has chronic pain and talk to them for 30 minutes. Mm-hmm. And if I took their pain scale before and after, I guarantee you after they feel better.
Right.
But I haven't done anything. But it did diminish their pain just because they had a chance to change their focus on it.
Right.
Yeah.
No, I think it's both mental and
Ooh.
physical. You hear that.
No.
I feel it.
Now what is that? Is that the fibula shifting?
Could be.
Okay.
No, this was a second surgical repair, same area.
It feels like there's a little shift in the fibula. Now, when it shifts, does it feel like you're just knuckle cracking or something?
Yes.
Okay. It doesn't cause any pain though.
I've never felt that before. Wow.
That's what it feels like it's shifting just a little bit. But
I don't know if that's in a good or bad
is it
way.
painful?
It's not painful. No.
Well, I wouldn't want to do it. I wouldn't want to do it forcefully. I'm just trying to see.
No, it's good.
Because that's what it feels like. It feels like the head of the
Knuckle
fibula is
cracking, yeah.
like shifting just a little bit.
And very well could be.
Yeah. And then if I go just a little bit higher in here, up towards the knee or down towards the ankle?
Down towards the ankle.
Okay. And then is that lateral again?
Yes.
Okay. Maybe right there.
That's good.
Do you get pain down in here at all?
Occasionally, yes.
And when you feel it, does it feel like it's just deep down inside the ankle, or does it feel like it's more out to the outside lateral, like it wraps around the malleosis?
Yeah, it definitely wraps around. I can feel all of that tightness in there.
All right.
So almost every day I have to work it out.
Does it feel stiff?
Yes.
Does it
Stiff and tight.
Does it respond poorly to barometric pressure changes?
Yes.
Yeah.
Yes, definitely can feel that.
I'm 42. I'm on TikTok now, and people are telling me I'm old, like in increasing numbers.
Yeah.
You know, and I'm like, hey man, shut up.
Yeah.
I do ache when my grandmother was the one who was when I was a kid. It's like, God damn, grandma, like you tell the weather with your body now.
Yeah. The moment I hit 39, it seems like life started to take a turn physically.
It just shifts.
Yes.
Yeah.
Amazingly so.
I wouldn't want to give up the wisdom I have though at 42.
Definitely. Definitely not. I don't mind my gray hairs. I've got plenty of those, but I don't mind them. I think they're all well earned.
So if you had a choice, would I keep going up towards the knee, or would I stay down here? Down more.
Yeah.
Okay.
And I'm not even sure now that we found that little shift.
Well, let me do a little bit of both. Sometimes what I notice is like people have pain in one spot. Even as a therapist, we don't realize sometimes it's coming from somewhere else. Mm-hmm. I just want to check this to see if your tib anterior is like pulling on your foot bones or whatever. Okay. Sometimes it feels like the muscle, it's almost like it chronically shortens. Mm-hmm. It's not fully contracted. It's just like, oh, hey, we're just going to limit movement here to prevent injury, is what it seems like. Yeah.
I can imagine this one. It's like that.
And right in.
Yeah, you feel it all.
There. So from there, is that too much?
No.
Okay. If I go up towards the knee.
Still good.
Or down towards the ankle.
When you go towards the ankle, I feel a little bit more pressure.
Okay.
Not pain, but pressure. And so it feels a little more effective for some reason.
And you prefer this a little more lateral right here?
Yes.
There we go. And then you broke your ankle when?
February 2018.
Okay.
Initial injury was August 2014. Had it surgically repaired, tib-fib fracture, surgically repaired. Plate and 7 screws, had the hardware removed 6 months later. But I never was, I wouldn't even say 75%, maybe just 75% functional. I could still feel my bones out of alignment. And then re-injured, fractured again February of this year. And required a repeat surgery. And this one actually feels more stable than I have in the last 5 years. However, we can tell it's not perfect just in this session alone. I've been thinking I'm perfect, but no. Come to Robert and hey, we find things that haven't been hidden and missed.
Somebody worked on me recently, and I use my feet more like some therapists use their hands. So I don't have any discomfort in my legs. That's not an issue. Right. Or my feet or anything. I don't have any ankle pain, nothing. But when they worked on me, the lower half, like below my gastrocs down to my ankle, like I jumped a few times. Because the tissue is just tight.
Yeah.
There's no pain, but it was tight enough that when they applied pressure, there's also less and less cushion. It's more like instead of being up at the upper portion of the thigh, you're towards the knee, the muscles taper. It's so thin, it was just like they'd press, and I'm like, hey, calm down. Slow.